Rajwinder body. Um, I lost my side vision, so you've lost your peripheral vision, and had cataract surgery a few years ago. Okay. And so, Raj, where are you? Where are you right now with your vision goals? Do you have some goals for your vision? Terry, you're 52. Okay. So I absolutely would put you on the C Clear with DMSO and the 3070, and obviously on the Revitalize. So those three. Rosh, third chapter. Just joining, had sudden retina detachment, ER surgery. Went on vacation, no symptoms, but blurred vision. Oh, while on vacation. So you had no symptoms, you just had blurry vision. They identified it as a retinal detachment, and I'm going to invite you up. And then you had surgery. Hang on just 1 second. Philip, how are you?
Opa!
Opa!
How you doing?
I'm doing great. It's so good to hear your voice.
I know, me too. I texted you. You got me worried. I said,
we're here.
Where's my people?
We're here. Your people are here. But let me call you a little bit later. I'm on live on TikTok.
No problem.
Excellent.
Bye.
Bye. Sure. That's my friend. Okay.
We have Raech's third chapter up on the panel. I believe that's yes.
Yes, I call myself Rachel. Rachel, I put it
Okay.
Raech because a lot of people called me that.
Yes. Raech.
Yes.
How are you?
I'm well right now. A little tired, but good.
So tell me, it sounds like you had a serious episode.
Very.
And yeah.
Very.
You were on vacation?
Yes, I flew to Savannah for 3 days on joining someone's trip, and was there Wednesday. I started feeling something, not pain, just I felt something there, and I would ask my daughter to look at it, but she said it was fine. And then by Friday, I just felt like almost like something was there. Nothing hurt, but it was just felt like lumpy. I can't really describe it that well. I had a heart attack 2 years ago, so I didn't want to play. I said maybe it has something to do with that. So I went to a local ophthalmologist, and right then and there, they told me I had to have emergency surgery.
Wow.
Yeah, and I had to, that night, I ended up connecting to a specialist at 1 o'clock. And then that night at 9:30, I had supposed to be 2-hour surgery, had 3-hour surgery. They did something called a scleral buckle, and then on the other eye, I had a lattice.
Okay. So they did a scleral buckle.
That's it, yeah.
Right. Okay. And
on my other eye, they said I had, I guess I would call it a scar. They call it a lattice, like the beginning of whatever was happening in my right eye. And they lasered it while I was down there. And that was July 18th of this year, and my eye is still very blurry. I haven't gotten my vision back. And they tell me that it's age, but I really don't think it's that. But I won't even get into what I think it is. But
okay. So lattice degeneration, just for everybody else's information, is a thinning or weakening of the outer edges, the periphery of the retina, the light-sensitive tissue lining the back of your eye. The affected areas often look like narrow, lattice-shaped crisscrosses or crisscross patches when viewed through an eye exam, which is where the condition gets its name. So it gets its name because it looks like a lattice. It says around 8 to 10% of the general population has lattice degeneration, but it's more frequent in people with moderate to high myopia. And what causes
What's myopia?
nearsightedness?
Nearsightedness. Okay.
While the exact cause isn't always clear, it's linked to retinal thinning due to poor blood flow or tissue changes over time. These weak spots make the retina more vulnerable to small tears or holes, especially if the vitreous, the gel inside your eye, pulls on it as it shrinks with age. Okay, so, and you're having obviously some blurry vision. Are you on any medication right now?
Just the medication that I was given when I had my heart attack. They put me on blood pressure medications, but I didn't have high blood pressure at all. And that's like their protocol, blood thinners. And they wanted to put me on, what do they call it, a statin, but that gave me a lot of pain, so I don't take that. So, body aches rather. So,
Okay.
but
I
that was
think
separate from my eye. My eye, they just gave me antibiotic drops and prednisone drops for like the first couple of weeks, and that was it.
okay. I think what may be happening in your eyes because you're having this bilateral situation where you're having this degeneration in both eyes, and I think what's happening is you've lost blood flow. You've got a blood flow issue in the eyes. Did they tell you anything about your optic nerve?
No.
Did they it's there? I would have a lot of questions because I would hope that they did a detailed eye exam and they looked at the entire eye, the optic nerve cup, as far back as they could see, to determine whether or not you had any other issues happening in the eye, like glaucoma. And this is the next thing that could happen, having had a retinal detachment and now you've had a retinal tear, is you can then start glaucoma. So increased pressure, intraocular pressure in the eyes. Blood flow is challenging. I mean, that's what causes these things, is a minimized blood flow in the eye system. So I would want you to get on a drop that actually is going to increase the blood flow. So that means I would put you on a drop with DMSO. I would absolutely put you on the foreign eye because we want to be reparative in both eyes as much as possible. I would also put you on the C Clear. We could do C Clear, or we could do the Luster Elixir. The Elixir has it has colloidal silver in it. So I'm just in my head. I'm sorry. I'm just thinking. But the Luster Elixir has colloidal silver in it, which is beneficial when you're in a repair scenario in the eye system. So I almost think I would rather go that route. Would go with the Luster Elixir, the foreign eye, and C Clear. No, Luster Elixir, foreign eye, 30/70. Because you've had a scleral buckle, you've got the lattice in the opposite eye.
Yeah. I feel like I'm falling apart.
You're not. You definitely need a kickstand.
And the sensation that I have in my right eye is difficult for me to describe.